This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2022. The numbers of anterior cervical discectomy and fusions, or ACDFs, and cervical disc arthroplasties, or CDAs, used to treat cervical disc degeneration have significantly increased over the years. Given the simultaneously rising healthcare expenses, transitioning these procedures to outpatient settings can decrease the length of postoperative hospital stays and associated costs. However, in order to classify cervical spine procedures that can be safely transitioned to outpatient settings, assessing their risk factors and prevalence of complications is crucial. Thus, the authors of this article sought to evaluate factors associated with the greater risk of rapid response events or postoperative complications. They retrospectively assessed a cohort of 1,040 patients, 888 post-ACDF and 152 post-CDA, and analyzed the occurrence of rapid response events and complications that were life-threatening, required interventions, or resulted in delayed hospital discharge. 3.5% of these patients experienced a rapid response event, and 2.3% experienced acute complications. Notably, patients who experienced a rapid response event had a higher risk of developing a complication or having an extended hospital stay. Dysphagia, the most common complication, occurred most frequently in patients with a surgical level proximal to C4 to 5. Revision surgical events placed patients at higher risk for rapid response events and complications. Older patients, active or former smokers, and patients with COPD, asthma, or an American Society of Anesthesiology or ASA score of greater than or equal to 3 are at increased risk for complications. Overall, this study highlights risk factors that increase the likelihood of emergent events and complications following commonly performed cervical spine surgeries. Stratifying patients based on these factors can allow for selection of patients who can safely have ACDF or CDA procedures performed in an outpatient setting.